So the reason we are here is because of the McPherson garden, Century Garden. We are entering our 4th year. That's right, seems like we've been there forever. And as we look at the display board, we started with lots of grass and nothing, and over the years, through CPA grants and tons of volunteer hours, we have what we have today. And so moving forward, we're gonna be doing a lot more, planting more flowers, and so we're always looking for volunteers. So that's my pitch. So most of us are over, I'll say 60. A lot are a lot older than that. So as we're in the garden, working and talking, which typically happens in the garden, which one of the reasons we love it. We laugh every time somebody tries to get up off the ground. So that is one of the reasons we came up with this idea, and I will introduce Leora in a minute, but what I have to do is say, if something happens and you have to leave quickly, just follow the exit signs there, back there, and here. Bathrooms are down below the elevator or down here at the bottom stairs. Okay, so, and for those of you who know me, this is my daughter, Leora. She's an occupational therapist. She's a PATH international riding instructor. She's a massage therapist. She's a member of American Hippotherapy Association. And she...
I have a lot of alphabet soup after my name.
She does.
Yeah.
So she's well qualified to be doing this. And also, growing up working with people with disabilities, she has really worked hard to recognize our bodies and our muscles and what we need to be strong and take care of our bodies. So she's was in a car accident as a teenager.
Okay.
Overcome those injuries, and so this has kind of set her on the path that she's on today. And so what she does now for work is, besides some massage therapy, she does equine assisted therapy as an OT. So understanding the body and that work is really, really important. So I will let her take it away and see what she's going to show us.
Thank you. So this is pretty casual. I want it to be mostly interactive because I don't like to stand and talk at people. I also work at Western New England in their OTD department, so I help the students learn how to integrate the information from the professors into actually treating clients that come to the community clinic. So I don't like to stand and lecture. All the presentations I've given through the AHA and PATH, you guys don't have to sit there and just look at me because that's not fun for anybody. So as Pat said, I'm an occupational therapist. I run my own small practice and I do manual lymph drainage as a lymphedema therapist. I do body work. I'm a real proponent of foot health because it's the foundation for our bodies and our structure. So they asked me here today to talk about how you can get back to the garden and have less wear and tear and pain for your bodies. So some of the things that we talked about that they wanted me to hit on was everybody has a hard time getting off the ground. So the handout you have is a bunch of exercises and movement patterns that can help your body feel strong enough to be able to get off the ground no matter where you are. So in just a little bit every day, run through it, 3 times on each side every day is going to help your body feel so much better because if you don't use it, you lose it. That's absolutely true. And motion is lotion. That's absolutely true. The more you move, the better you feel. And the other thing that they wanted me to talk about is how do we utilize the tools that you guys like to use in your garden effectively so you're using your muscles and not just relying on your skeleton and your joints wearing down. So we'll go through some of that. And if there's anything specific that you would like to address, feel free. If there's a movement pattern that you want me to kind of help you get through so you feel comfortable with it, we can do that too. I brought my mat in case anyone didn't feel comfortable getting on the ground. So let's start with the handout, because I think that is going to be super important for everyone, even if like you tend not to garden on the ground. Just a few things. We tend to get disconnected from our bodies, right? Like, I mean, how many actually know what their feet are doing at any given moment? We put all these things on our feet that inhibit our feet's ability to interpret the environment around us, and that's not always great. So when you're in the garden, wouldn't it be lovely to just be barefoot and just like feel the dirt? And isn't that so nice? So if you can convince yourself that that's a great idea, I highly recommend it. Some of these exercises, a lot of it is the intention behind it. So you need to think about connecting with your body from your brain out. So if you think about where your shoulders are, like what does that mean for you? So for me, when I think of shoulders, I think of this whole complex here. And it's not just like this part where we think about when we go, oh, like touch your shoulders, and all the kids do this, right? It's your shoulder blades are a big proponent of your shoulder. If those don't slide against your thorax, then you can't actually lift your arms up, because bone inhibits bone, right? So when you go to like grab something or reach something, it's really important to think about, okay, these guys need to be moving out of the way. So we tend to be very front-centric as humans, right? We do everything here in front of us, but the parts of our body that stabilize and have the biggest muscle mass is on the back side of our body, right? So when we go to move things, I'm like, oh, I need to go get that jar, or I'm going to pick up that rake. We think about doing that from the front of our bodies, and then we end up like this, like really far away. So you need to start thinking about the back side of your body. How would I get that rake with the back of my body? Because these are where the big muscles and the overlapping of fascia that controls all of our movement happens back here. So if I'm going to grab a shovel, I'm going to go from this direction, right? I'm going to think about the back side of my body and have that go. So the first exercise that's on our sheet is those arm circles, and that's going to get your shoulder blades sliding against your rib cage, against your thorax. So yeah, sorry, they were stapled backwards. We can blame my 11-year-old because he distracted grandma while they were printing them out, right? It's Everett's fault. I'm sure he distracted you. Yeah, right. So for all of these, you're going to think about, first and foremost, wherever you're positioned, if you're sitting on your bum or if you're standing on your feet, you're going to think about how can your body be the straightest it can possibly be. And if you think that you have like some helium, like helium balloons, how they like just levitate and float, if you think that that's what's filling your lungs, and that's going to help pull your trunk out of your pelvis and get your spine a little bit aligned without you having to force it, right? We don't want to force our muscles to do things. We want to allow space, right? Because when we force, we get tense, and that's not fun for anybody. We don't want to be tense. You're going to allow some space and get your abdominal muscles to kind of do some work, wake them up a little bit. So even if you need to give them a little jiggle to wake them up, you give them a little jiggle, and you say, okay, guys, our belly button's coming in, our butt cheeks are going to squeeze a little bit, and then your arms can come up, right? So if your arms can come up and do this motion, yeah, go for it, girl, get it. Yeah, and think about, can you feel your shoulder blades slide around on your back side of your body? They might be a little crunch, 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 a little crunchy crunch. That crunching is good, because that means things are trying to slide around where they're supposed to be. And if you do this every day, then they're going to stop crunching, right? Just that's it. And you can feel your shoulder blades start to slide a little bit, and you can connect with the sensation that's happening here. You might feel like, ooh, my arms feel a little bit sore. That's a good thing, right? Because then you can feel them, right? We want to feel them. Okay, so the next one, you're all sitting perfectly well for this. You're going to be on the edge of your chair, right? So that we're having to support our own bodies and not relying on some hardened wooden thing to support ourselves. And you're going to have, one arm and leg go out. And if that feels too strenuous, just leave it like that, and maybe just the leg. And then it's going to come up this way, right? And that helps, you're going to stretch that arm as far as you can up towards the ceiling, and it's going to keep your trunk nice and straight. Can you feel a little strain there? So while you're doing that, think about, those shoulder blades that we just were sliding around? Think about where they are. Are they forward? Are they up by your ears? You want them kind of sinking down to your butt cheeks. That's where those shoulder blades belong. And then see if you can switch. Yeah, yeah. The leg that's out has the hand that's out. Those guys are going together. Yes, opposite. Dead bugs are opposite, yeah. So, and again, remember those shoulder blades are going to be kind of dragged down towards your butt cheeks. That's the direction you want those shoulder blades to be. Yeah? That feel okay? Yeah? Okay.
So how long should you hold that?
Whatever feels good to you. Everybody's bodies are different, right? So if you feel like holding it for a while is what's going to help you remember how to hold your body, go for it. If you think, oh, 1 second's probably good and then I need to switch, that's okay too. Because everyone's bodies moves a little bit differently because we have different life experiences. So it's not a one size fits all. These are general ideas on how you can move your body to reconnect and feel what feels right for you. And if you listen to your body, then you're going to be guided on the right path. The next one is just standing up without using your hands. So I worked for a lot of years in a hospital setting, in an acute rehab, and it was drilled into us. We always have our patients have to put their hands down and push off, and they have to push off, and they have to find the armrest. Like if you didn't have armrests on your chairs, you were a bad clinician. And now that I have been out of the hospital system for a while, I'm like, I don't really know. Like that's great for acute rehab, right? When you're just getting back from whatever's happened and you're trying to get home, absolutely. But as you get stronger and as you spend more time at home, the further away from that injury you are, the more you should be able to do things under your own muscle power, right? And be aware enough of your surroundings that you're not going to sit down without a seat behind you, right? So if you can get on and off a chair without your hands, then you know that your muscles are going to be strong enough to get you on and off the ground, right? Because you might not always have something to help lift you up. So if you can just stand up and then make sure the chair's there still, give a little looky-see. We don't want anyone landing on the floor prematurely. And that's going to be important. And if it's challenging for you, tucking your feet a little further behind you and getting to the edge of the chair is going to be helpful because it's going to help your center of gravity pull forward so that you can then push off with your butt cheeks. All right, so even just a couple of those is going to help your body feel a little bit better. Yeah. And if you feel like this is a big strain, all you have to do is 2 things to remember. Squeeze your butt cheeks and tighten your belly. Those 2 things will help you get through any exercise, right? Because it's going to engage the stabilizing muscles that makes our appendages move off of us. Okay, next on our list. It's just lifting a leg off. And the idea is eventually that you can just stand on one leg and balance. But if you need the chair to help you, then that's okay too to start with. And this is actually a big indicator. My dad and I were talking about it earlier. It's a big indicator for fall risk. If you can stand and balance on one leg for over 10 seconds, your fall risk dramatically decreases, right? And so practicing at home, honestly, I have my clients, when they need to continue to work on their strength and balance, I'm like, while you're doing dishes, stand on one leg while you're doing your dishes. While you're waiting for your coffee to percolate, stand on one leg while your coffee is brewing, right? If you're standing there talking on the phone and you're just kind of lounging around, practice these things. Stand on one leg for a little while and see how that feels. And eventually, you can do some marching to alternate, if you'd like. And then you'll be able to do it while you're stepping up onto a box, right? So step 1 is, can I balance? Can I pick one foot up and not wobble and fall over? Can I pick the other one up and not wobble and fall over for a decent amount of time? And you can do it where then you start to tap on your step. And then you can get like a small little box or a stool and you can step up and step down. And those things are going to help strengthen kind of this whole back chain so that you can get off the ground without trouble. Right? Okay. Another thing that happens is that we forget that we need to rotate our bodies, and our spinal cord is encased in the spinal column, the bones, the vertebrae there, and they have these interesting little kind of nooks and crannies, so they have to kind of sink into each other like my knuckles, and they can only rotate as much as the other one rotates. They have only a few degrees of rotation, but when you combine all that rotation, we have a lot of mobility in our trunk without moving our pelvis or our feet. So over time, we forget that each little vertebrae has a pretty good degree of rotation to make us move. And so we tend to just be like, oh, I'm just going to turn my head can I just look over there? Because we don't need to do a lot of rotation during our day unless you intentionally do it. But rotation is huge for being able to utilize the spring mechanisms of our body to get the things done and generate force and power. So like when you're raking, it's all that rotation. If you use the rotational power of our body, then you're going to have less wear and tear and less strain on yourself. So being able to rotate is important. So that next picture of the woman that she's turning sideways, and she's just saying, how much can I, oh God, this way is harder for me. How far can I rotate? And it's going to have to come from the whole head. Like your head is going to look and lead the way, and it's going to go all the way down to your booty. Right? Does everyone have a direction that feels easier than the other way? I sure do. Right? And again, you don't have to hold any one position. The more you move back and forth, the more limber you'll be. So if you can do some rotation in your day, that's great. And then once that feels easy and comfortable, you can add in the leg if you can. So you can cross one over and then go the other way. Yeah, just whatever you can. If you can't cross an ankle over a knee, that's okay. Yes, yep. So if your right leg is up, you turn towards the up leg. Turn towards the up leg. Yeah, there you go. Turn towards the up leg. Yeah. Okay, what's next? Oh, yeah. Yeah. Peg, was it you that said you do dead bugs at the library, at the gym? Yes. You did dead bugs, yeah. Dead bugs is one of my favorite exercises. So the last thing, everybody, this is like a good precursor to being able to get down on the ground, right? Everybody lays down flat at some point in their day, right? Whether it's just going to bed or waking up in the morning, or sometimes, I don't know, how many actually like get on the ground intentionally? Yeah. Yeah, see that word intentional? That's key there, right? Okay, so the last one. You can do this on a bed. On a firmer surface is ideal because it's better supporting for your body. But if you don't ever get on the ground, which I highly recommend you practice getting on the ground and off the ground, you can do this on any kind of flat surface. And like Peg said, you're going to alternate. So when you come onto the ground, you're always going to start with your knees bent and your feet flat on the ground. And that's going to help your spine and your pelvis and your shoulders get in alignment and feel supported. So give yourself a moment on the ground to feel how the ground supports your body, so you're not doing the work to support yourself. And you just let yourself kind of sink into that for a moment and allow your pelvis here, this big bony chunk that stabilizes our legs, to be nice and strong. So you're going to think about, if you were going to cough, what muscles work when you're going to cough, and it's a lot of your transverse abdominis. So that transverse abdominis is going to hold you steady. So I'm going to think about, if I were about to cough, what would it feel like? I'm going to hold that position while I raise my arms up to the ceiling. And I'm going to push my shoulder blades down into the floor so they can feel the surface that's underneath me. And I'm going to think about that sensation. And then I'm going to bring my legs up. The whole time, everything's staying still. Now to start, you're just going to tap your heels. Okay? And then when that feels easy and comfortable, then you're going to start moving your arms while you're tapping your heels. And you're going to feel your shoulder blades sliding around against the floor and between the floor and your ribs while you're moving, right? And then it's going to become a big movement. But step one is just get down to the ground, figure out if this feels okay, and just do some heel taps. And that sensation of what your body does when you're about to cough is going to help you engage the abdominal muscles that need to work to provide stability for yourself. Now we're down on the ground, right? And how to get up. So for me, it's not so hard, right? Because I'm on the ground and off the ground all the time, all day long. I work with people from age 2 to 96. That's the age range that I practice with now. And so everybody has to figure out how to get up. Now, everybody can squat, but because we don't do it, we've lost the ability to do it, right? But you can get it back. You can squat. Pat can squat. She's over 70, right? So if you practice the movements required to do it, you can do it, right? You should eventually be able to get off the ground without using your hands, right? No, it can come back. It can come back for you, right? So if you think about it, so when you're on the ground, most of the time you probably come over to your hands and knees, right? And then you're either like, oh God, okay, now I need a break because that was a lot of work, right? Yeah, and then you crawl to the chair and you get up, right? Right? Thank you. Now, all of those, that's perfectly wonderful, right? It's totally fine that that's your strategy for getting off the ground. Through moving your body and being intentional about how you move your body, you can start to develop a stronger connection between what your brain wants you to do and how your body can react to that. And then your joints will get more limber, your muscles will get stronger, and you'll find that you might not have to crawl all the way to the chair. That if you are on your hands and knees, maybe you can kind of rock back and get yourself up onto one knee. And maybe you can start to do that process where you can just get off the ground without having to get to a surface. There is nothing wrong with having to get to a surface that then helps you in that process to get up. It's really safe, and it can be helpful when you're feeling pretty stuck, and instead of calling the fire department and be like, I fell down, can you come get me up? That you can just get to a place to do that. But hopefully with doing a little bit of movement every day and thinking about how you move every day, you can kind of decrease that risk factor for yourself. Does anyone want to go through and try any of those in a more intimate way so that you can feel comfortable? Is everyone good?
Later on, I'll try that. But what do you do if you have like total knee replacement? I can't bend down.
Right.
And I fell when I had surgery on my right arm, so I'm kind of like.
Yeah. Did you have surgery on your right arm and surgery on your left knee? Yeah. So, right, when post-surgery is always hard, right? And you always feel like, oh, I'm never going to get back to the same place I was. But if you continue to move, if you continue to push through, right? So you reach a boundary. If your knee's like, no, that's about all I can do. If you just think just a little bit more, each time you just ask for a little bit more, you will actually continue to gain.
So that, my arm is excellent. My arm is better than it was before I even fell, to be honest.
Oh, that's great.
But this knee, I cannot, and I'm getting a little concerned because.
Yeah.
So I'll be able to move it more up
Mm-hmm.
on my.
Right. So you're like, I can come here, right? Because when we help with our arms, the muscles of our leg aren't doing their job, right? So all of our muscles in our body work in tandem with another muscle. So one muscle is being stretched while it's asked to work, and the other one is contracting while it's asked to work. And then we do the reverse to get the opposite movement pattern.
So that's actually the muscle, then that's not the knee. I'm thinking in my head, it's the metal inside my knee that's stopping me.
No, so the replacement joint doesn't have any restrictions in it. It's our body's restrictions that are created by that. So you've had a big insult to your body, and your body's like, what are you doing? It's still in stress out mode, right? And when we have pain, it still is triggering those same, like, something is wrong. So your brain has a lot of control in that regard. Information comes into our brain, and our brain has a reaction to it. So if we can change the information coming in, then we can change the reaction coming out. And so if you can ask your knee to do a little more, right? You sit on the edge of your chair and you're like, okay, can you just give me a little bit more? We're just gonna give a little bit more. And you're using other parts of your body to help that. But if you use the lower extremity to help the lower extremity, it's gonna do more for you than if you're like, come here, leg, let's do this, right? Because then these guys aren't doing anything. The muscles here and the muscles here aren't doing anything to help that, right? These are, but that's not translating into these guys turning on and off to get the job done, right? We need these guys to turn on to flex the knee, and we need this guy to relax enough to elongate to allow that to happen. So if they don't work together, nothing's gonna change. Yeah, and if you do have some pain or if you have some swelling is a big factor, right? One of the big parts of my world is managing swelling for my equine partners and for people. And our bodies are designed pretty well that we don't have a lot of extra space, especially in our joints. And we have swelling in our joints, it can become a big block. So our lymphatic system is in charge of managing that swelling. And if the lymphatic system is kind of being pokey or it's not being supported by your musculature, then things can kind of get stagnant and stuck, which is why movement is so important, because the lymphatic system doesn't have its own pump like our circulatory system does. So it relies on our muscles and our movement to keep itself going a little. We can do some skin techniques to help it along, but movement really is key. So when you do have swelling, gentle movement, just even like if your hands are sore just a little bit, it's gonna help them feel better. Putting lotion on, the act of rubbing lotion on, what are you doing with your hands? Your joints are just moving a little bit, and that is what's helping the hands, not necessarily the lotion itself, but the act of applying the lotion, the movement we do when we're applying the lotion, that is what's actually getting us a little more benefit. And yeah, if you're putting some arnica or something on, that is going to penetrate the vasodilator, so that's going to help some too. But the movement part is really key. The muscles kind of compressing around that and getting those anchors to open so the lymphatic system can drain the fluid and garbage away. That's the important part. So if you have some swelling, a little compression is helpful, but getting the muscles to do their job is key. Okay. I'm going to go off on wicked tangents, so you'll have to just rein me back in. Any questions? You see I'm off the edge? Okay. We can come back to exercises if anyone has questions after.
What if you have both knees? You're not supposed to put pressure on them.
Right, well, how long ago was your knee replacement?
My husband actually.
Oh.
3 years ago.
3 years ago? Right, so every surgeon has their own ideas about length until you can return to normal activities. And a lot of it is just covering their own bums to make sure they don't have to come back in. But yeah, when the tricky part about knee replacements is that patella isn't typically replaced, right? It's the mechanisms on either side of the bone that are replaced so that you can have a smoother gliding surface, right? So it's the patellar alignment that is the tricky part. And if you're weight bearing into the patella and it's not in the right spot, it can feel pretty uncomfortable. You're not actually going to cause damage to the replacement part by kneeling. It's the discomfort and can you bend and then can you get back up off of those knees that is really the deciding factor from the clinical perspective. Right, yeah, of course, because the surgeon scared your pants off of you, right? Yeah. Yeah, exactly. It's uncomfortable because there's still. Yeah. Well, the more you interact with it, the more you teach the body what it needs to learn. Okay, here we go. I'm jumping off the edge again. Yeah. So we have a lot of nerves in our body, and all these nerves, they have different jobs. So some pick up temperature, some pick up light touch, some pick up deep touch, some pick up specifically pain in different ways. So when we have a surgery, the surgeons don't be like, well, let me avoid some of those nerves in the lymphatic system of the blood. They just cut in and they just pull it apart and they do what they got to do and they disrupt the whole mechanism, right? So then when your body is like, oh my God, there's been injury, super glue it back together. That's what our scarring is. It's literally the body just laying on some super glue. And it doesn't know. It's not saying, okay, well, this is supposed to be this and that's supposed to be that and it's all supposed to lay nice together. The body's just heal that now, right? Squirts in the super glue and you're left like this. It's all this just jumbled stuff. And so our job as the healing process is you gotta touch it and you gotta say, hey, your skin, you gotta move like this. Hey, your muscle, you gotta move like this. Hey, your nerve, this is what it feels like over here. This is what it feels like. So you can teach the body how to be how it was before, but you have to really be intentional and you have to do it like every day, right? Or the brain's going to be like, well, that's not working anymore. I'm closing down that highway, right? Because the brain has to, like I said, it's got to interpret the information. And if the pathways are interrupted or they're not being used, it's like the highway, right? When you get snow on the highway, sometimes you got to slow down and the information's not getting there as quick. But if the snowplow trucks are pushing through, clears it all up, then that highway is back to being functional. So it's kind of what you have to do after surgery. So yeah, if you're having trouble, you can't put weight on your knees because you're having pain, then you need to find other surfaces to utilize, right? So there's a ton of these kneelers out there that you can like go on the internet and Google garden kneelers, right? And some of them are like high, like the garden bucket, and some of them are kind of in between and low. So if you really can't because your knees are not going to allow it because you have a lot of pain, you have a lot of swelling, maybe you've had a stroke and part of your body's not working as well as it used to. You're going to set yourself up in stages, right? So if you can get on and off a chair, fantastic. Then you make sure you have a chair out in your garden space. And then maybe the next thing is the next one down is a kneeler. And then you can pop yourself to the next one down. But you're going to have to work within what the range your body gives you. So if you can't flex more than 90 degrees, then you're going to have to stay on a surface that doesn't make you do that until you work your body into being able to do it lower and lower, right? And so for someone that like, oh gosh, I got on the ground and I can't roll over onto my knees. What am I going to do? Or maybe I can maybe I can get one leg underneath me and I can come up sideways, right? But again, can your body be strong enough to support yourself to do that? And that just takes practice and intention. So, I've worked with a lot of amputees, right off the bat. And one of the things we do before they have to go home is floor recovery training for everybody, right? So that, because chances are when you just had an injury or insult, you're going to end up on the ground at some point, right? It's just going to happen. And for someone that's had an amputation, it's really dangerous for them to land on that residual limb because it's pretty raw still, right? And so how do you get up? Well, you have to use what you got. You got one strong one, use that strong one, right? And so because everyone is different, every scenario is going to be different, then you take the person in front of you, right? So if you need some one-on-one, we'll do some consultation, right? If you want to figure out how you can get on and off the ground with your knee pain, or if your husband's like, man, I really wish I could get on the ground and help you weed, honey. Said no one ever. Okay, well, let's figure out how that's going to work for you, right? These are general guidelines and helpful tips that may not work for everybody's situation because everyone's body's different. I'm happy to do some personal consultation if that's what you need. But yeah, sometimes it's just tricky. And you got to use like a little step downs to get yourself in the place you want to go. So maybe you can't go from here all the way because your shoulders are bum and you're like, it's not going to work. Well then, okay, so what's my half step, right? Maybe I get onto the little kneeler that's that way. And then from this position, from halfway up, then I can get the next step up. So sometimes you have to have like a tiered approach to how you can get off the ground. And that just means that when you go out to your garden, you have to set up your environment for your success. So if you know that you're going to be on the ground and you're like, not sure I can get up there without some help, then bring a chair with you. Bring a little folding chair. Bring a steady surface that has 4 points of contact with the ground that's not going to tip over when you put weight on it. And just prepare your environment so that you can be successful. Okay. Ask more questions. I'll go off on more tangents. Okay, so we'll go into a little tool use, yeah? Okay, this is one of my favorite ones because it means you don't have to weed so much with your hands, right, Mom? She says her favorite thing, right? What is it called?
So people call it different things. I call it a shuttle hoe. Some people call it a stir hoe. It can be, depending on who sells it.
It's a thingamajiggy. It's a thingamajiggy. All right, so One of my fondest memories of working in an outpatient clinic was when I convinced one of the physical therapists to use a crutch. That he had a patient that was having a lot of back pain, and she was like, "It hurts so much when I vacuum." And I was like, "Hey, Bob, why don't you use a crutch and simulate vacuuming so you could figure out what's wrong?" And he was like, "That is such a good idea." I'm like, "I know, OTs, right?" So we do the same thing with our shuttle hull, right? So when you're using a tool, we want to maximize what the tool's intention is, right? So it's got a lot of mobility. It's got some like little wiggleness in there, right? And the whole point is it gets into the dirt and it ruffles up the roots, and then the weeds kind of are on the surface, and you can either pull them out or you let them die, right? Right? Is that right? That's right.
Sometimes it'll cut the above ground from the roots, and either way, if you do it on a regular basis, that should kill your weeds.
See? Perfect, right? Then you don't have to get down there on your knees. Right, so things that have long handles, we need to utilize that long handle. It's there for a purpose, right? So that we don't have to be like down here and be like, right? Because that doesn't feel good to anybody. So a staggered stance is going to be ideal for almost all of our tools because our body likes to move in diagonal movements. Like that's how we're designed to get maximum power. Like when we walk, our arms alternately swing because of the diagonal fascial pulls of the posterior chain. So that probably didn't make any sense to you guys. So this butt cheek and this shoulder are connected by this band of kind of like spider webbing material that allows it to kind of expand and contract together so that when they move, it's kind of like a spring. I lengthen the spring and then it recoils together, and so I get more power that way. And it happens from the front, but a lot from the back side. And the same thing from the opposite cheek. So my right butt cheek and my left shoulder are also connected by that spider webbing, which means that we can get a lot of power and force just by doing some rotation. I'm doing literally nothing with my upper body, and I'm just rotating through my trunk and using that recoil of my spring of the back muscles to do some movement here. That's it. I don't have to grip this hard. And if there's resistance from the ground, sure, you're going to want to put some pressure in there. But all I'm doing is turning my belly button, right? And it's getting all of that force. So I'm not being like, because that's going to put a lot of strain on your, sorry, and on your shoulders. And that's not going to feel, everyone's got like, oh, my shoulders are not great. Nothing feels great. But you don't have to use your shoulders to do that. You can just swivel your hips and use your butt cheeks, right? It's all about the butt cheeks. So when I push forward, my leg that's in the back, those muscles all there turn on and they say, go forward. And that's all it takes because everything is connected. So you think about that, if you're about to make a cough, what those muscles are going to do when they do that, they're going to get tight all through here and up the front. And before you pick up your tool, if you think, okay, I'm about to cough, so okay, that's ready, and my butt cheeks are getting ready, and now I can use a really strong trunk to let my legs and my arms move off of. So with this little nose picker, this has a better name than that, right? But like, it reminds me of a nose picker, so that's what we're gonna, right? So you can do the same thing. It's this, because all of our tools we use in this forward and back movement, right? Just like you're vacuuming, just like you're sweeping, just like you're shoveling horse manure, like we do my whole life. That back and forth movement takes all the same stuff. So a staggered stance is ideal because then it sets us up for a good base of support. We're not going to fall over, right? And then we get that strength of the diagonal movement patterns that our body really likes. And that way you're not using your shoulders to pull from. You're not using your neck to strain. We're not kind of creeping our shoulders up to be earrings. It's just nice and easy, right? How many had kids? How many people have had kids? Yeah? Who's never held a child in their life? Nobody, right? So what do we do when we pick up little kids? Do we just rock them? Because we can't help it. I still do this with my 9-year-old who's like feeling crummy and he's like, Mommy, I need a hug. I'm like, okay. And you just can't help it, right? So what are we doing? We're doing some rotation. We're just twisting our bodies because this is what our bodies want to do. We like it. They want to do it. So do that when you're gardening. Be like, oh, I'm just going to rock my baby while I'm raking, right? So one of the tools that we use it's a little bit harder to do that rotation with is like a rake, right? Because this is a pull. We're going to pull towards us. So in that first exercise where we kind of got our shoulder blades sunk back together and we did some arm circles, you're going to think that motion when our arms are up and our shoulder blades are pull down to our booty. That's your start position for when you do your rake. You're going to think, okay, I'm going to cough. I'm going to get my shoulder blades towards my middle and down towards my butt. And then I'm going to grab my tool and I'm going to pull it towards me so that the motion is coming from your back and not from your front and your neck. So we're not doing this. I'm not being like, I'm gonna, It doesn't have to be maximum effort. It just has to be prep. I'm going to think about what I'm going to do before I do it. And then I don't need maximum effort. I can just give myself minimum effort. And then I can do it for longer.
So you don't want to bend over when you're doing that?
No. If you have to bend over, right? You have to bend over because sometimes stuff gets sticky and you're like, I just really need to get in there. Any flexion has to come from a joint that actually likes flexion. So our hips like flexion. So when I bend my hips, my booty has to go back so my shoulders can come forward, right? Our spines only have little bits. And our spine is designed in a way to help us stay balanced. This is like a bowling ball on top of a spring, right? So when the bowling ball moves, everything has to shift and be like, oh, we got you, right? So our spine doesn't like to do this because then it shifts everything off and you have a lot of straining to do to keep the bowling ball stable. So if you can bend at your hips, bend at your knees, and allow this to happen, it's going to be so much more protective for your body, and you're going to use less strain on muscles that are designed for stabilizing and not for movement. So we have big muscles that are designed to move our joints, and we have little muscles that are designed to stabilize us in position. So when you really have to see you got something, it's really hard, if you kind of get down and I'm going to attack it position, then it's going to be easier to give it a good pull. And again, when I do that, it's coming from my legs and my booty, your booty. Our bums have so much good muscle there and we forget about them. They're not just to look good. Our butts have a lot of function and purpose, right? So we're going to squeeze those cheeks and give it a good pull. Does that help? Yeah, a little bit? Okay. All right, we all have to dig some holes in my yoga mat here. Ideally your tools should be designed for a purpose, right? Someone along the way was like, I'm going to extend my arm so that I don't have to get on the ground to do that raking and pull that weed. So we don't have to get on the ground with a little trowel and dig a hole. We can use various sized shovels. This is a lovely tiny little shovel there. And it's the same thing. You're going to want to set your body up and prepare for the movement you're going to do. So if you're just going to kind of shove it in there, right? If I'm going to use my arm muscles to kind of get some movement in there, I should probably use my big muscles to help me if I really want to get it in the ground. So I set my back, I set my calf muscles, I hold my shovel in a position where I think that's going to hit the ground when I lift up. So when I come up and I come down, I'm using more of my mass to get the shovel into the dirt a little bit. And remember we talked about balancing on one foot? Super important if I want to pick up a foot to then shove it onto my shovel, right? And not fall over. So the more you can do things outside of your garden activity, prepare for your garden activity, the easier it will be to do your activity. Right? Yeah.
I may have missed this earlier, but you keep talking about your calf muscle. Can you do that again?
Yep. So when we cough, it takes a lot of abdominal muscles to make that happen, right? Right? So instead of me being tighten your transverse abdominis, make sure your obliques are doing their job. Make sure your rectus abdominis is connected from the bottom of your sternum to the bottom of the top of your pelvis, right? That's a lot of stuff that everyone's like, what the heck are you talking about? But when we cough, we know what that sensation feels like. When we cough, we know what muscles, what turns on in there for us. So if you think, I'm gonna try to cough and then hold that tension you feel in there, then you're stabilizing the trunk from the front. And then when you set your shoulder blades down and towards your booty, you're stabilizing the trunk from the back. And then you have all the rotational power that you need to perform all your tasks. And it's setting your body up, because if all we have is a bunch of dangly bits hanging off of something in the middle, right? And if that something in the middle isn't stable, the dangly bits have to work harder and they can't stabilize themselves and do their jobs, which is why we get wrist pain and elbow pain and hand pain, because the dangly bits don't have anything strong to work off of. This is where we have all of our strong muscles, is in the center part. The dangly bits, I mean, I'm not the biggest person, but there's not a whole lot of stuff there, and I'm pretty strong. So we got to utilize our design. And our design is, this needs to be stable so these things can move around. And if these things don't have anything to work off of, just like any of our tools, like if you had a bend in here, or if this was made out of plastic and it was left in the sun and it was getting brittle, you go to use your tool and the end's not going to be effective, because what it's working off of isn't stabilized. So that's what that setting your body up, turning on the muscles of the trunk is important. So yeah, but the tricky part when we like suck our belly button in, so if I suck my belly button in, I'm only getting one of the multiple trunk muscles to do its job. And then I'm like kind of holding my breath, and then my diaphragm can't work, and then I like can't breathe very well. So if you're just constantly being, come on in here, then it like makes everything else here go icky. What we tend to do as we get through life, and we've had jobs where we've had to sit a lot, or we've had jobs where we've been stationary a lot, is that we forget that to breathe with what we're supposed to breathe with. If you watch a baby belly, when they breathe, their bellies are like whoosh, 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 right? Because they're all diaphragm. And our diaphragm is our main breathing muscle. And when it contracts, it creates suction, so our lungs can pull in the air. And then when it relaxes, it sinks back up, and our lungs get a little smaller, and we spew out the CO2. So when we hold in our belly button, we're putting a lot of upward pressure into the diaphragm, and then it can't really do its job. And then we try to start breathing with our secondary breathing muscles, which are up here in between our ribs, and these muscles up here in our scalenes. And then we're like, okay. So we can't get full breath, and then we're stressing out parts of our body that are meant for helping later. Like if we're running from a lion, and we really need lots of oxygen coming in. But like when we're gardening, we're not hopefully stressed out. Hopefully it's relaxing, and we're nice and calm. And so that's why I think about when we go to cough, we're using all of those muscles. And so it's not a holding of like just one that's going to inhibit our ability to keep nice, good breaths. Does that help a little? Okay. What else? Oh, there's tools in here, right? Okay. 50-pound. Pat has this lovely little squishy cushion on her bucket. Okay, so you probably all have gardening buckets or containers that you carry around, or maybe you stick all your stuff in a wheelbarrow and wheel it around. If you sit on a bucket like this, and then you go and do stuff like this, that probably doesn't feel great. Plus, who has the hip flexibility to do that besides people that practice hip flexibility all the time, right? So maybe that's not a great idea. But who's to say you can't like take your little cushion and put it on the ground so when you sit on it, your butt's not dirty, right? But you're not going to do that. We got some nice little tools. It's another nose picker? I love it. Right. So what even my gardening tools, I don't garden a lot because I don't got time for that. But I've noticed that they all have pretty nice handles that are easy to hold, even if your hands are kind of have arthritic changes in them. So that's really lovely. So you don't have to worry about like getting a built-up handle or doing anything like that to adjust the grip of your tools. But even if you're using something in your hand, right, this is so far away from my base of support here that if I don't make sure that this is strong and stable, that when I do these motions, all of the force is going to be transferred down here, and it's going to be uncomfortable because these aren't meant to do force. These are meant to do intricate, small, fine motor movements. And the closer I get to my support base, the bigger the movements can get by using the force of the big muscles. So when you go to dig and shovel, you still have to do the same thing as when you're using a big tool. You have to set your shoulders up so that the strength is coming from all of our big muscles back here. We got how many, I'm sure you heard this a lot, your rotator cuff, right? Everyone talks about the rotator cuff. Well, that's just a teeny little things that just help hold the humeral head into that socket. This is a 3-system mechanism right here. You got your shoulder blade sliding on your ribs, you got your humeral head sunk into this thing that's just flopping around in there, you got your clavicle that makes this point in there. I mean, that's a lot of parts that need to move in there. So you need to use those big muscles, not just the teeny little rotator cuff. You need to use that big fat deltoid. Like this guy is like big and it's monstrous and it can do a lot of work there. And you need to use your pec and all the muscles in the back. All these muscles back here support this dangly bit over here. So if they're not doing their job, the dangly bit can't do its job very well. And you're going to end up with pain in your elbow, pain in your wrist, pain in your hand. You gotta move it. Right? You gotta move, right? So literally just doing some arm circles is gonna get that because the deltoid is working the anterior, middle, and posterior part of the deltoid just by doing arm circles. We could have a fun time with shoulder exercises. Do you want me to go on a tangent on that? So, right? So,
when I started doing that, my arm couldn't go this far. I'm like, got to.
And now you're like, woo, look how far it can go, right? Yeah. So say you can only, you're like, oh, that's about as far as I can get. My shoulders don't want to come up any more than that. Then you need to utilize other surfaces to help yourself. It's as simple as using the back of a chair, right? So you can't raise your arm more than shoulder height because it's like things aren't working there. Your shoulder blades are likely the culprit because if they don't slide out of the way, the humeral head can't actually move forward because the top of the shoulder blade has a little point there and it knocks into it. And so you have bone, and your body's like, I ain't doing that. And if you have any discomfort, your body's like, no thanks, no thank you. And then the less you do, the less you can do. So get those shoulder blades back down towards your booty and just back yourself away until you can get more height. And then when you're like, ooh, that's about all I can go, you're going to say, come on, body, stretch a little bit more for me. Move a little bit more. So you're going to knock on the door of your end point and just ask it to shove a little bit more. And each time you ask that shove, you're going to get more, right? Because what we don't want to do is trigger a huge pain response because then your body's going to backpedal. When we have a pain response, the brain sends chemicals to the body and is like, hey, don't do that. Something's not right. And you can cause swelling and inflammation, and then your body has to then navigate through that. We don't want to do that. So if you just knock on the door of discomfort, each time you knock on that door is going to get further away. And eventually, it's not going to be there anymore. So first step is being able to get the range of motion that you need. So get yourself to be doing, the full range that you have. And if you start with your thumbs up, that's the optimum position for your humeral head to be. So when we do it this way, it rotates the bone, and then you have less mechanical advantage. I can still do it because I have to do it all the time, but it's tricky. So if you can start with thumbs up, that's ideal, right? And even this way, thumbs up is ideal. And then you start adding resistance to your movement patterns, right? So, okay, once you can do this, you're like, oh, great. So now you do that with resistance. Maybe you have some stretchy bands. Maybe you have a can of soup at home, and you're like, I'm just going to work out by putting it in my cabinet and taking it down. I'm going to put it in my cabinet, and I'm going to take it down, right? So when you're putting your groceries away, make that part of your exercise. Okay, I'm going to get my bag of flour. I'm going to put it on the counter, right? Everything you do, if you do it with intention, will build strength and range of motion. But we could go I could give you a whole handout on shoulder exercises if you want. Anybody put their email list down on there? I'll just, if you want more things, just put a little asterisk and I'll send you more stuff. Yes? How I would use them? I would say, here, Mom. Here are your tools and my children. Go have fun. That's what I would do. Right, so if you can get on the ground and kneel, right? So say this is my plot of grass that I don't want to have grass. If you can kneel, great. If you can squat, even better. Squatting is how our bodies are designed to get down on the ground. Like this, all the flexion, right? And you can do it. Pat, come show them how you squat. She's like, hell no, right? So the more you do it, the better you can do it, right? Can you do it still? Yay! 74 in squatting.
I do it every day.
Right.
And then I can get up because I do it every day. And that's the difference. If
Yeah.
you keep going. Wait a minute. You know what? This is my favorite tool.
I wasn't going to pull that out because it's sharp. Okay. So, right. So you have a couple options, right? Squatting is ideal because then I'm not bending my back, right? I'm flexing the joints I need to flex to get me down to the surface I want to get at. But I get that this is not an easy position for lots of people to acquire, right? And even kneeling, whether you're in high kneel or you're sunk back onto your heels, that's not also a comfortable position, right? There are some modifications that you can do or adaptations you can get. There's this cool thing called, I think that a lot of construction workers use it, and it's like you attach it to your leg and it provides some cushioning behind your knee and a metal support so that when you kneel, you're kind of on that structure as opposed to on your own skeleton. But again, that's going to get you kneeling like this. So unless you can then get yourself in kind of a quadruped on your hands and knees position, it's going to be hard. What you want to try to keep in mind is that if your back can stay straight, you're going to have a much easier time. And then you're not going to have the much strain on your body, especially your neck.
Yeah, say those last two sentences again and louder.
So if you can keep your back straight and you're on your hands and knees, it's going to be much easier for your body. You're going to reduce the amount of strain on your neck. And then again, if you're on your hands and knees, guess what has to be strong already, right? Our trunk. And so our dangly bits can then work off of our strong trunk. Just sitting on the ground is great. If you can sit and you move sideways, right? Our body likes to move in kind of this pattern, right? Our arms like to be on the side of our body. If you do a lot of rotation and that feels comfortable for you, then by all means go for it. But you're going to want to change sides frequently. So if you sit on your booty and you can do your raking or you can do your digging, you're not going to have the same amount of force that you can put into it if you were in a different position, but it might be your best option. And so maybe you manage how much you can do in a time. And so you're like, I want to spend 3 hours in my garden. Well, that might not be appropriate for what your body condition can handle at the moment. So maybe you start with like 15 minutes and then you give yourself a break. Research has shown that if you give yourself a break before you hit your fatigue level, then you actually can get a whole lot more done than if you work yourself to fatigue. So if you do 15 minutes of activity, then you go take a water break, even like that 3 to 5 minutes of decrease of activity, builds your battery back up so that you can do more. So if you can put it into, I know none of us like to take breaks. I'm just going to get it done. I'm already down here. I'm just going to do it because I don't want to get up again and I don't want to get down again. Right? Like, that's completely understandable. But you're actually going to be able to do more with less damage to your body if you give yourself a break. Plus, getting up and down is good exercise, right? So sitting sideways is a good option. And, obviously sitting crisscross applesauce is not ideal for a lot of people because of all the flexion in there. It might not feel good. But if you can sit and do things on the sideways, then you're going to want to change. So you spend like 2 or 3 minutes one direction, and then you're going to rotate to do the other. Doing all of your activities with both sides of your body is going to be important because then you don't get extra wear and tear on one side and get some overuse injury. and then you have to get up. And then you have to get up, which looks different for everybody. Pat's favorite tool is this this thing, that whatever she called it. And it has it's kind of a blade on one side and a serrated edge, and it's kind of bowl shaped. So you can slice through things and saw through things and dig a nice hole. But you do need a little force when you use it. So again, all of these tools, you're going to need to think about how your body is set up so that you can use the force that you have inside of yourself, right? And it's going to look different for everybody. The way I garden is not going to look the same as the way Pat gardens, because our bodies are different and we use our bodies differently. But the concepts of being intentional about how you want to move and setting your body up for success are kind of the key components there. So getting a little more connected to what it feels like inside of your body is going to be a huge step forward in being able to make adjustments that will feel better in the long run.
So if you're using a rake and you're right-handed, you would rake a certain way. And do you make yourself rake a different way left-handed to balance it out?
You just switch sides. You just switch hands. I think that it's easy for us to get stuck in this right-handed, I'm only right-handed, I'm only left-handed. As an occupational therapist, I don't ever expect people to do things that I can't do. So when I started working a lot with stroke patients, many had to then switch from their dominant side to their non-dominant side. And if I couldn't brush my teeth with my left hand, my non-dominant hand, how could I teach someone else to do that? So it's pretty important to recognize that your brain has the capacity to learn new motor patterns through your entire lifespan. So maybe you've been super right hand dominant your whole life. Start brushing your teeth with your left hand. It'll take only a few times before your body feels like, oh, that's not so bad. You're not going to shove it up your nose, I promise. Right? So when you do, say, if you're right hand dominant, it tends to be kind of lower on your rake, right? And some people might hold it in this position where your hand is kind of in a up position, like holding a bowl of soup. They call it supinated. And some might hold it in that down position, like a bowl. So it doesn't matter. It's whatever feels comfortable for you. But ideally, the more you rotate through your options, the less strain you'll have on each muscle group. So if you're doing it this way, then you're going to switch and you're just going to switch, right? And you may feel like you have more power one direction than the other, but just give it a little bit of time and it's going to equal out. The more you use each side, the easier it'll be to do it, because it's just going to get stronger. Your body wants to be equal and balanced, but we tend through life to just ignore what our body wants and just do what we want to do, right? And so how often do you find yourself standing and you're just mostly standing on one foot? Right, all the time. And you're like, what am I doing? I better stand on the other foot, right? So the more you can become a little self-aware, the easier it'll be for your body to become more balanced, and then you'll have more strength to put into your activities, right? So I have to clean a lot of horse poop, right? It's part of life. I got to clean a lot of horse poop. I've had to clean a lot of horse poop for a lot of years. So when we clean the stalls, right, I'm kind of doing the same movement. I have to scoop it, and then I have to bring it over and to do it. So as I do it, I think about how can I do this and make it be an exercise? How can I do it so I'm stronger at the end instead of weaker at the end? And so I'm like, well, here we go, and here we go. So I make it into an exercise and a dance as opposed to, it's just a chore that I have to do. And you can turn your activity into something fun and beneficial for your body just by thinking about doing that, right? You can be like, I got a rake because there's freaking acorns on the ground and I hate stepping on the acorns. You can treat it as a chore, or you can treat it as something that can be delightful, right? You're like, I'm gonna rake those acorns up and it's gonna be great, right? You have the ability to do that, right? It's all right up in here in that highly functional executive part of our brain, right? So you can decide that it's going to be helpful and beneficial to your body, or you're going to treat it as like And that makes a difference. The intention you put behind the activity makes a huge difference. So when you are doing it, you're gonna, okay, pay attention. How do I have my hands this time? This time I have my hands like this. Okay, great. And I'm gonna rake. And then I'm gonna be like, oh, what does it feel like if I do it this way? Oh, that's interesting. And then I'm gonna switch sides. I'm gonna be like, okay, I'm gonna feel like I'm gonna pull this way. And then I'm gonna put some downward pressure and see if that gives me something different, right? So if you put intention and awareness behind what you're doing, it's gonna make your body feel better.
Is it back and forth when you're raking, or is it a turn? Are you twisting a little?
I think you're gonna do well. I think it depends on what. So if we have like a garden rake and we're trying to just loosen dirt or getting the soil even, or maybe we're trying to get rocks out or leaves. So like the leaves would be more like this guy over here. I find that when I do raking for leaves, I do a little bit of both. I do a little bit of trunk rotation and a little bit of pull. So you're gonna make sure that all the muscles of your trunk are on and ready, and that your shoulder blades are down and back. And that way, however you need to move, your body's gonna be prepared to stabilize you to do that, right? And your booty's always gonna be ready for action, right? Does that help? And if anyone wants to move through movements, you can come on up, grab a tool, and we'll dance. Anything else? Any questions? Did I get everything?
I think when you go out to garden, you should set something with some good music that gives you some rhythm, so that
Yeah.
instead of again being like, oh damn, I got to get this done. So it's like, okay, this is a time out here with some music.
Yeah.
And outdoors. That's where we like to garden, right? Because we like being outside and enjoy communing with nature.
Right. Take your socks and shoes off. Roll up your pants. Get in that dirt.
Right.
Make it fun.
Absolutely.
Yes, sure.
So I just wanted to say.
She had a question. Zip it.
I'm going to forget what I was going to say.
Oh.
So I'm just going to say, because of bad, just plowing through stuff. Okay, so we do have horses, and carrying one, heavy water bucket. So now I'm smarter, and I carry 2 half buckets. So if you're in the garden and you're carrying something, think about balancing that with your, on both sides of your body. Don't just always, like my bucket's way too heavy. So what should I do? Well,
Get 2 buckets.
Get 2 buckets. So I'm done. Your turn.
So Laura, if somebody has used the back brace because back is weak or tired or hurting, I have physical therapist tell me, go ahead and wear it because at least the rest of your body is getting the exercise or the whatever. Because I think the back brace seems to be cheating. She said if it's hurting, on the other hand, it's keeping you in the house, then
Right.
put it on. So I don't know, what do you have to say about that?
I have lots of things to say. You want to hear all of them? Okay. So there's 2 things. One is that if we want to be able to do an activity that we love, then we have to think about all the components that we need to make that activity possible. So if you need your trunk muscles to help stabilize you, then you need to prepare them and get them strong enough to do the job you're asking them to do when you put them under stress. And that's all of that, all the exercises that kind of get yourself ready to do the activity. Now, if you don't have the time or you have other limiting factors and your body isn't ready to perform the activity you're asking it to do, then you need to provide yourself with some supports to get that done. So say you're having a really good day and your trunk feels really strong and you can go do the garden and you don't need the back brace, fantastic. But if you're having a day where maybe you're getting sick or hormones are going wackadoo and your body's not feeling great, then wear the back brace because it's helping provide the support that your body's not able to provide yourself at the moment. Ideally, we want our bodies to provide the support we need. We want them to do the compression. What the back brace does is provide the compression that the calf muscles would be doing to stabilize the trunk, right? And even with the back brace on, you still want to activate those muscles so that they're doing their job, because the back brace is not going to provide all of the support because it doesn't anchor the body the way our muscles do. But if you need it so that you can get through what you have to get through without a lot of pain, then you do what you got to do. It's the same thing. I have like I could go for like an hour and a half just about foot health, right? You ready for that? No, we're not going to do that today. But in all therapy, we want to make sure that the body can do what it's designed to do, right? We want to, if things aren't working well, we want to strengthen it and help it move through the right patterns so that it can do what it's designed to do. And that involves the feet, that's the knees, the hips, all the way up to the top of our heads. So you want to make sure that, like, if something is weak because it's not being able to do its job, we need to find out, okay, why is it weak? Is it weak because my brain and my body aren't talking to each other and I don't even recognize that there's something down there that needs to work? Okay, well then we need to fix it from that perspective. If it's not doing its job because it's not strong enough to do its job for what you're asking it to, then we need to strengthen it, right? And if it's not doing its job because there's movement restrictions, okay, well let's tackle the movement restrictions. Likely it's all of those things wrapped up together and we need to tackle all of those things together. So if you feel like wearing a back brace allows you to do what you want to do, you do what you got to do.
Then the next line is go home and exercise the show.
Right? But if you don't want to have to rely on an external thing and you want to rely on your own body, then you need to teach your body to do the job it's supposed to do. You need to help support it get stronger so that it can do what it needs to do to support you. Does that help? Yeah, so wear it if you need to wear it, but ideally, if you can get yourself to the point where you don't have to, that would be better. Yes.
I have a question about the feet.
Okay.
I had chemotherapy a number of years ago, and I have peripheral neuropathy, which is part is numbness and part is pain.
Yeah.
So is it safe to wear, like, for instance, those barefoot shoes? I'm not sure to put on my feet. Yeah. You know, I don't do barefoot. I don't, so because my feet are tender, which means you can't do it, so they get more tender. But I have those little barefoot shoes, but I'm afraid to wear them because I literally the numbness is not really an issue.
It's this,
very severe, and I don't know if I'm making it worse or better.
Right. So our nerves, all they do is they pick up information, right? So the other nerves that are down there that should be also interpreting other sensation besides pain, they're not knowing what to interpret. So the pain signal is getting to your brain first, and it's a continuous track. So if you can provide a different stimuli that interrupts that pain signal, the pain will start to recede and be less. So you can do things like take a washcloth and rub it from the back of your leg where it feels normalized onto your foot and help teach those nerves down there, hey, this is what this feels like. This is okay. Walk barefoot on a carpet, walk barefoot on a hardwood floor, get your brain, and while you're doing it, be intentional about, okay, this is what this texture feels like. So you can start to retrain how the brain interprets the information and get it away from that constant pain signal and interrupt that pain signal with actual stimuli that tells you more information. And you can use a tennis ball on the bottom of your foot to help make it more limber, and so that the receptors in the joints can start giving your brain information, and that will help interrupt that pain signal too. So you come see me, we'll talk feet. I love feet. It's like my little side project.
I actually want some of those there.
I have them. I've only worn them once because I wasn't sure if it was healthy.
Right? So here's the thing, when we make any changes for ourselves, right? If you're used to, I call them foot coffins, which are shoes, right? I don't like them at all, because if we think about the shape of our feet, they're meant to kind of go like a duck foot, right? To give us a nice big base of support. But what do our shoes do? They go whoop to make us look all dainty and pretty, blah, right? So if you're used to doing something a certain way and you make a shift, it has to be a gradual shift or you're going to cause yourself more discomfort, and then your pathway there is not going to be very pleasant. So if you want to, you wear your barefoot shoes for 30 minutes. Then you give them a break, maybe for a week. And then the next week, maybe you wear them for an hour or 2 30-minute blocks. And you slowly get your body used to doing it in a different way. So like a back brace, if you're used to wearing it all the time, you need to start going without and then inserting your exercises to kind of do this like weeding process. So I'm going to use this less and do this more. And it's the same thing when we're transitioning your footwear. You go from something that's highly supportive, you need to strengthen your feet and let them interpret their new environment in a way that supports them into this less support and more on their own, right? Our feet have a ton of muscles in there. They are designed to be very strong and propel us through this world without extra junk on them. But we put junk on them, and then our feet are like, well, I don't have to do anything. Or we sit down for a large part of the day instead of walking for a large part of the day, and then our feet don't have to do the work they were designed to do. So it's that same thing. Like if you don't use it, you lose it.
Are those barefoot shoes supposed to be worn all day type thing, or no? Because
I only wear barefoot style shoes 24/7 because my body is used to that and it likes that. And if I could go totally shoeless, I would do that. But I can't because I work in a barn and I don't want to step on horse poo with bare feet, right? And I don't want to step on nails with bare feet. And Pat yelled at me as a kid because I'd try to go to the barn barefoot. She's like, put your shoes on, right? So, right. So,
I'm just curious.
yeah.
I did buy a pair because my husband and our son were taking us to Paris in June.
Oh,
And with my knee, I can't walk like I used to walk.
Mhm.
It's just sore. So my daughter last night, they were home in Portland, Oregon.
yeah.
She goes, are you walking, Mom? And I'm going, listen, I can't keep up with you guys. I already told you. You continue going, I'll stop somewhere, have a cocktail. And
Come back and get me.
And they expect me to, I guess, go to that Eiffel Tower and walk up. I says, are you guys nuts? I can't even walk up normal stairs without.
Yeah.
So the barefoot shoes, if I can get used to them, then that's probably a good thing, because I have been wearing them.
It just depends on if your feet are the muscles of your feet are gonna be strong enough to then help the rest of the body, right? So it's all about the gradual acceptance of, oh, my feet need to do more. So at the end of the day, it's okay that your feet are sore because that means that the muscles of your feet have done a lot of work, right? Like when you garden for 6 hours, is your body sore? Probably, because you've done a lot of work. If you go out for, a walk and you haven't done that in a while, your body's going to be a little sore because your muscles have worked. So it's okay that our feet are sore at the end of the day because then they've done their work. So if you're going to start transitioning to barefoot style shoes, then you need to be smart about how you do that. And it's got to be incremental. Maybe you walk for 10 minutes in those shoes and then you go back to your other footwear because your feet are going to be tired. And then you just slowly build up. So it really depends.
I have been doing that, so that's,
Yeah.
I guess I'm doing the right thing.
Yeah.
And then the other day, I go to stand up and the ball of my foot was killing me. I couldn't walk on it for like 3 days.
Yeah. So it's not just walking in barefoot style shoes. There's a lot of components that you have to increase the mobility of your foot, like the flexibility of your foot, and then you have to increase the strength of your foot. And so walking in barefoot style shoes helps do a couple of those things, but it's not the only thing. So when you're transitioning into a more barefoot style shoe, you have to, use a tennis ball and roll. You have to get in between there. Here, you got to get in between there and mobilize your joints, right? You got to let them move, right? So that they feel like they can do what they need to do. And after I could do another foot class. We can talk about feet for 2 hours and be happy to, right? Right? You got to just like we would do with any other body part, you got to get them a little, just like when you're shoulder rehab, you start a little bit and you get them more flexible. You got to allow the joints to do what they need to do. And then you need to do exercises to get them to do what they need to do. So you get the big toe moving without the little toes, and then you get the little toes moving without the big toe. And you get your foot strong enough to support it. So what happens is that we are like, oh, I'm going to get a barefoot style shoe that gives me no support, right? And it's going to fix everything. But it's the same thing as like, if I'm going to go from a back brace, I'm never going to wear a back brace ever again. But then we don't do the other things to support how our body needs to be able to hold itself, then we're only doing part of the puzzle. And then you have to go back to your other shoes because you're like, oh, it sucks, it didn't work. But we didn't do all the puzzle pieces. Maybe you have one puzzle piece, or maybe you have 2 of the puzzle pieces. But if you don't do the whole package, then it's going to not be as effective. Any other questions? Any garden questions? Back to gardening. It's really easy to go off on tangents. I'll talk all day about foot health. Yeah, and so we're used to relying on our surroundings to support our bodies, but when you do that, your body has to do less, and then if we do that all the time, then our body does less and less and less, and all of a sudden your body's like, you want me to do what? You want me to hold myself? Psh, I haven't done that for a long time. Why would I do that? So the more you can challenge your body to do what it's supposed to do, the easier it'll be when you want to put it into action.
And what Leora was saying was changing your shoes. Like, think about what shoes you wear when you're in the garden, or, you know, just get up every day and put on the same old shoes. And I don't think that's going to help your feet any if you put on work boots to go work in the garden if you're not used to wearing them other times. So, I mean, I have this type of sneaker, I have leather work boots, and I do change them regularly. Because if I don't, then my feet. So, I don't know if I said that right, Laura, but.
Right, I mean, it's just like, you know, if you're gonna say you're gonna go travel somewhere, and the expectation is that you're gonna be walking for like 5 hours a day, and you haven't been doing that, it's probably not gonna feel too great after day 2, right? So, and if you bought a brand new pair of shoes, right, this happens all the time. You get a new pair of shoes because you're gonna go do that thing. My husband's notorious for this. He's like, I think I'm gonna start running again. So he gets a brand new pair of shoes and then goes out for like 6 miles after not running for like 6 months. And he's like, I don't know why I have blisters. I'm like, look. Right? Can y'all connect the dots there? That's not the greatest idea. But, you know, in college, I worked at Eastern Mountain Sports, right? So a lot of people would come in. I was in Vermont, and they would come in from hiking, and they're like, I'm going to hike the Appalachian Trail. I'm going to hike the Long Trail. And they want a brand new pair of boots. I'm like, when are you going? And they're like, I'm leaving in a couple weeks. I'm like, these are not the footwear you are walking in, right? You put them on for an hour and then go back to your sneakers, please, because your feet are going to get torn up, right? So it's the same thing. If you get a brand new pair of shoes and you're like, I'm going to spend 8 hours in them right away, maybe dial that back a little bit so that you're not uncomfortable. I think that's what Pat's getting at. Okay. Well, can I take that off? Yes.